Hello everyone. So our next question is 19th one. In the development of the inflammation process, glucocorticoids reduce the level of certain important active enzymes. It results also in the reducing of synthesis of prostaglandin and leukotrienes, which have a key role in the development of inflammation process. What is the exact name of this enzyme? So here they are asking about the arachidonic acid pathway, right? So as they are saying here, the process in development of process. Okay, in the development of inflammation process, the glucocorticoid, okay, inflammation process. Okay, and reducing the synthesis of prostaglandin and leukotrienes. So here they are asking about what? They are asking about the arachidonic acid pathway. So first we need to know about this. After that we will know which enzymes is inhibited, which enzymes are inhibited by glucocorticoids. So first what happened? First tissue injury. Okay, first tissue injury. Then what happened? Then injury to phospholipid cell membrane. Okay, now starts our pathway. After that what happened? After that arachidonic acid formation, and here there is a stimuli comes from inflammatory stimuli, and here there is one enzyme. This is called phospholipase A2. Then what happens? We have pathways. First one is cyclo oxygen pathway, and second one is deep lipo oxygen pathway. Here we have our examples of COX1 and COX2. I think you have heard about it. Then formation of prostaglandin G2. Then prostaglandin H2. Then we have prostacyclin, prostaglandins, and thromboxane. In this pathway we have leukotrienes. Okay. Now they are asking about the enzymes inhibitors. Okay, so there are some drugs which act on certain areas, okay, to inhibit this pathway. The first one we will know about this enzyme phospholipase A2, and a drug which inhibits this is which drugs? Corticosteroids. Okay. Then we have these things. They are inhibited by, you know, NSAIDs like aspirin. We also call them COX inhibitors. Here there is one inhibitor, that is Xileuton. So as you know, leukotriene, it is a mediator mm, which we get in our lungs, and this causes bronchoconstriction and the symptoms of coughing and sneezing and asthma also. So we inhibit in these cases. So we have one inhibitor here is Xileuton, and we have leukotriene inhibitors. Those are montelukast, zafirlukast. So here there is one drug, corticosteroid, which inhibits the phospholipase A2 pathway. So this totally inhibits the arachidonic acid pathway, and it inhibits the inflammation process. Okay, and if we go in this pathway number one, we have inhibitors of COX, inside is aspirin, and if we go to pathway number two, we have Xileuton and leukotriene inhibitors like montelukast, zafirlukast. So let's get back to our question. They're asking about glucocorticoids, and it inhibits what? It inhibits phospholipase A2. Okay. Next question. A 30-year-old female with rheumatoid arthritis of 5 years duration complains of pain in the first three fingers of her right hand over past 6 weeks. The pain seems especially severe at night, often awakening her from sleep. The most likely cause is. Okay, so first there are few things which we need to exclude here. First one is what? They are asking here about pain in the first three fingers of a right hand. So hand, atlantoaxis subluxation of cervical spine can't be our answer. Okay. In rheumatoid arthritis, it is not only limited to the first three fingers. Rheumatoid vasculitis, no symptoms of vasculitis here. Sensory peripheral neuropathy will not only involve three fingers. Okay. So left only carpal tunnel syndrome. You know what? You know something about carpal tunnel syndrome, right? So we need to know about nerve supply of our hand. Sorry about the drawing first. Okay. I'm not used to with this pen at first. So it seems like it's rubbing. So they're asking about the first three fingers. So this area is affected, right? This area. Now we need to see the blood supply. So for that we will draw two things. First one is palm position and second one is dorsum. So in palm position, what happened? We have our hand again. Here the little finger. Here our thumb. Sorry again for the drawing. This is palm side and this is the dorsal side. Okay. So nerve supply in the palm side, what happens that 1, 2, 3 and 3.5. So this portion, okay, and here, okay. So this portion, it is supplied by our median nerve, okay. This portion is supplied by our ulnar nerve. Second, we will draw in our dorsum portion what happens. So this portion 1.5. So here we will draw our 1.5. So this 1.5 portion is supplied by what? Ulnar. And this portion is supplied by what? This portion. This is supplied by radial. And this again median one, okay. So red is median one, blue ulnar, green radial, okay. So they are saying about the first 3 fingers of the palm. So it is supplied by median nerve, and we are talking about. So now we will see like why this carpal tunnel syndrome happens. So what we are seeing carpal tunnel syndrome, right? So carpal tunnel syndrome. So first we need to know what is carpal tunnel. So when you dissect the wrist area, you will get something like this. This structure. So this is the carpal tunnel. And what happens, as you can see, here we have our median nerve. So when this area carpal tunnel get inflamed or something like that increase, our median nerve get compressed. So when median nerve get compressed, what happens? We get symptoms in this area, or you can say this area. Okay. This area is affected. This whole area, the palmar side, and in the dorsal side, this area. Okay. So in our question, what we saw? We saw pain in the first fist, first three fingers of the right hand over past 6 weeks. Okay. So we know that this is a case of carpal tunnel syndrome. Okay. Next one is a easy one, nothing to be explained. A 19-year-old man has suffered from moderate mental retardation. So we get our first hint here, moderate mental retardation since childhood. The patient is illiterate, can take care of himself, do simple household work and other kind of easy work under supervision. So what does his rehabilitation tertiary prevention? When we say tertiary prevention, it is the disability modification. Okay, like how can we modify his lifestyle? We cannot modify the disease here. Tertiary prevention, we will try to modify his condition. So physical work under supervision, it's already mentioned. Supervision of relatives, so it's needed in home, and also consultation of any social worker. So here the answer will be all of the mentioned above. Okay. Then next one, a 38-year-old patient was urgently admitted to the hospital with complaints of sudden weakness, dizziness, loss of consciousness, body weight loss, nausea, vomiting, severe pain in epigastric area, diarrhea, skin hyperpigmentation. So we got here lots of symptoms. Complaints of sudden weakness, dizziness, loss of consciousness. Sudden weakness, dizziness are your non-specific symptoms. Loss of consciousness, body weight loss, nausea, vomiting, again non-specific. Severe pain in epigastric area, diarrhea and skin hyperpigmentation. So there we have these 5 diseases. So first we need to differentiate the diseases and we need to know about them a little bit. So what is pellagra? It is the simplest one and an important one in FMG exam also. Pellagra. It is due to deficiency of niacin or vitamin B3. And we have a mnemonic here for pellagra. It is 3T. That is dementia, diarrhea, and dermatitis. In dermatitis we have a specific sign. You can see the photo in internet. It's called castle necklace sign. So we don't have anything like this here, so pellagra is out. For scleroderma, what happens in scleroderma? In scleroderma you will have joint involvement, then you will have GI issues, you have hand swellings, narrow blood vessels due to calcium deposit. So nothing here like this also. For meningoencephalitis, what happened? You will get some uh, focal neurological symptoms. Okay, here we don't have any focal neurological symptom. For meningitis, you will get the chronic sign, okay, which is knee extension pain. Okay, then there is one also Brodzinski sign, that is neck flexion leads to knee flexion. Okay, so we can discuss this topic separately in any video. Okay, if you want, you can comment or email me. Meningoencephalitis, acute gastroenteritis, you will have the GI symptoms. Here we don't have any GI symptoms specific. There is only nausea and vomiting. Okay. No history of fever too. So we left with Addisonian crisis. What is Addisonian crisis? It is, sorry, it is acute adrenal insufficiency. Acute adrenal insufficiency. Okay, you will get some symptoms of hair loss, abdominal pain non-specific, blurry vision, and hyperpigmentation. Okay, abdomen pain, hair loss, tremors, depression too. Okay, we will get decrease of serum sodium and increase of serum potassium too. Okay, so here we get our hyperpigmentation here. Okay, nausea, vomiting, abdominal pain. Okay, so these are symptoms we can suspect that we have Addisonian crisis. Okay, I think that's all. See you in next video. Also, if you want to know about what is adrenal insufficiency, so we need to know the pathway first. Okay, so how adrenal gland work. So the first regulator is, as we know, hypothalamus. Then from there, anterior pituitary. Then signal comes to adrenal gland. Okay, and then release of cortisol. Release of cortisol, it leads to inhibition to things. So we get negative feedback. Release of cortisol inhibits anterior pituitary. It also inhibits hypothalamus directly. So we get negative feedback here. Okay. So this is a cycle. And we have some hormones also, right? So here we have what? We have corticotropin releasing hormone. Then Here you have adrenocorticotropic hormone. Okay, we can write here cortex of the adrenal cortex specifically. So there can be blocks in many areas. So first there can be block here, okay, block in the this area. So corticotropin releasing hormone get blocks. Then we can get blockage of here adrenocorticotropic hormone, and then lastly here. Okay, so if we get blockage in these two areas, okay, so number 1, number 2 and number 3. So if we get in number 1 or number 2 level, it's secondary adrenal insufficiency, and if we get in 3, it is primary adrenal insufficiency. So if problem is above the adrenal cortex, it is secondary, and below the cortex, it is primary insufficiency. So I think that's all for this video. See you in next video.